Hello and welcome to the recovery training about baricitinib. This is the current design of the recovery trial. Eligible patients, that is those who have been admitted to hospital with proven or suspected COVID-19, can enter any number of the randomizations shown on this page that they are suitable for. That is, those that are not contraindicated and are available at their site. Part A randomization comprises of the early phase assessment, comparing dimethyl fumarate to usual care alone. This is available at a subset of sites in the UK only. Part D in the bottom right compares baricitinib to usual care alone in the UK and infliximab to usual care outside of the UK. Part E compares high-dose corticosteroids to usual care alone in hypoxic patients and is presently only available to sites outside of the UK. After randomization, all patients are then followed to collect outcomes until the earliest of death, discharge, or 28 days later. Baricitinib is a licensed oral treatment for rheumatoid arthritis. It inhibits JAK1 and JAK2, which are part of the signaling mechanism for many cytokines, as shown in this figure. The JAK-STAT system transmits the signal from cytokines binding at a receptor on the cell surface through to the nucleus, where they affect gene transcription. Baricitinib also inhibits tyrosine kinase, which has a similar function. Tyrosine kinase activity has been recently identified as a marker for severe COVID, so inhibition may be beneficial. Baricitinib was tested in the ACTT2 trial of 1,033 patients hospitalized with COVID-19 in the United States. They were randomized between baricitinib plus remdesivir or placebo plus remdesivir. The primary outcome for the trial was time to recovery, which was shortened with the addition of baricitinib by 1 day. So participants receiving baricitinib recovered 1 day earlier in 7 rather than 8 days. Secondary outcomes looked at mortality and the use of invasive mechanical ventilation, and encouraging signals were seen here. In terms of safety, baricitinib was very well tolerated, and in fact, serious adverse events were less common in participants allocated baricitinib compared to those allocated placebo. The main contraindications of baricitinib include pregnancy, an EGFR of less than 15, including those on dialysis or hemofiltration, a neutrophil count of less than 0.5, and current active tuberculosis infection. All women of childbearing potential entering recovery should have a pregnancy test. If they refuse this or it is not available, they should not be entered into the baricitinib comparison. Because baricitinib is primarily excreted by the kidney, participants with suboptimal kidney function should have a reduced dose. For those with an EGFR between 30 and 60, a baricitinib dose of 2 milligrams once daily, that is half the dose, should be used. In those with an EGFR between 15 and 30, 2 milligrams on alternate days should be used, or if 1 milligram tablets are available, a dose of 1 milligram once daily can also be used. The only significant drug interaction for baricitinib is with probenecid, when the relevant dose of baricitinib should be halved. Co-administration of baricitinib with tocilizumab is now allowed within the trial, given the increasing number of patients likely to receive tocilizumab as part of usual care. Both baricitinib and tocilizumab may increase the risk of other non-coronavirus infections. Giving both together might increase this risk further. However, this needs to be weighed up against the potential benefit of treatments in severely ill patients with COVID-19 who still have a significant mortality risk. Managing clinicians can exclude participants from this comparison if they feel the risk of other infections is too great. Additional safety information on non-coronavirus infections will be collected on the trial follow-up form in order to monitor the effects of these immunomodulatory treatments closely. The main adverse effects of baricitinib include infections, abdominal symptoms, including uncommonly diverticulitis, headaches, and rarely neutropenia and liver function test disturbance. Supplies of baricitinib for the trial are available through standard NHS stocks, but for participants who are given baricitinib, we would request a BlueTech form is completed. But this is kept very simple, so it will not take long and can hopefully be done by pharmacy colleagues. For further information on other interventions in the trial, such as the early phase assessment of dimethyl fumarate, please see the individual training modules on the study website. Thank you very much for listening to this presentation.